Nice. Congrats. Awesome. Well, we are live. Hello, everyone. My name is Dr. Emma Shapiro, and I will be your alternative healthcare career coach for today. And I am here with Dyan and Mitch. They are from Marvel Medical Staffing, and they are therapist and therapist assistant. Yes, assistant turned recruiters. And so we are coming on here just to really empower you that you have so many options as occupational or physical therapists or speech therapists and as assistants. And so thank you, Dyan and Mitch, for coming on and agreeing to chat with me a little bit today.
Yeah, thank you for having us.
And then for anyone listening, if you do have any questions, feel free to put them in the chat, because that's the one nice thing about going live is that any questions you have, we can go right to the source and get them answered. Well, I know I was talking a little bit offline with Mitch and Dyan. And so Dyan's been a recruiter for about 19 months. And then Mitch has been a recruiter for about 7 months, which is really nice, I think, because you're seeing fresh, all of a sudden, like, how's the learning curve? And then you're seeing a little bit more established, how's the growth? How's the stability of the job? And so I think what I'll do first is talk about, how is it working as a recruiter? Because I think the most important question everyone gets is like, will I like this other job?
Yeah.
Please.
Okay. So I really enjoy it. It's totally different than being in healthcare and seeing patients. And there are like a lot of factors that you don't really consider ahead of time. It's not like an 8 to 5 job. You are pretty much on call all of the time. So you do have to keep that in mind, especially like if you have young children at home like Mitchell does, then you definitely have to be good at balancing like work life and home life and
Honestly, it does. It's a different kind of management in a way. You come from, clinic, you come from patient care where you're there, you're seeing your patients per the day, right? On the schedule set for you. Here you kind of make your own. You are on call a lot, but at the same point, you're able to manage that and set those expectations early. If you're able to set those expectations, as Dyan has taught me, it's able to be done. I think the biggest thing is you're still able to kind of keep your clinical hat on a little bit. Yes, you're not treating patients. Yes, you're not doing the day-to-day one-on-ones per se, but you're still able to keep your clinician hat on a little bit.
Definitely. That's what I always liked. So I'm a former travel physical therapist, and one of the things I really liked about recruiting was that. And I did a lot of sort of mentorship for therapists, and assistants interested in traveling. And that's the nice thing, and why I think it's so awesome to see therapists and assistants becoming recruiters, because you can answer so many questions that a lot of these newish grads or more recent therapists and assistants have. And I think you can help ensure that they feel really comfortable, that you're choosing a setting that's going to be good for them, and not just like a recruiter who has no idea what is acute care, what is acute rehab. You guys can really help guide, because especially I feel like a lot of travelers are newer grads, or in that 1 to 2 year newer in their career. And so I do agree with you. It's really nice you can keep that clinical hat on and help, rehab professionals just like yourself. What would you say, Dyan? Go ahead, Mitch.
It makes us relatable, 100%.
Yeah.
I mean, to say that we were there, we've treated that patient population and or understand what they're going through. If they are going through any sort of questions, rough times, you talked about being a mentor yourself. I enjoy that aspect of it very much so as a recruiter, playing that mentorship role a little bit more so than others maybe.
Definitely. What about you, Dyan? What are some things that you like about being a recruiter?
I do like the flexibility. Like you can go out of town and continue your workflow needs while you're gone. And I like not being paid per visit, because that was hard, especially during COVID. And we were seeing like declines in caseload. So there was always like that financial struggle. And it's just nice that now you're on salary and then you do plus commission. So really the harder you work, the more money you make. And um, it's very different. Every day is different. And we've just got a great team here too. We've got a lot of clinicians on our team that we're able to bounce ideas off of. Just on our team here, we've got one PT, three PTAs, and a CODA. And so we always
and those are all
talking-
recruiters.
Yep.
All recruiters,
Nice.
yeah.
Yeah. So we're able to talk shop anytime a traveler calls with whatever issue. Usually among the five of us, one of us can be like, oh yeah, I've dealt with this, and jump on the phone with them. And then if we don't have the answers, then we will always like do our best to figure out a solution, or we have mentorship within our travelers. So we'll find like an experienced traveler who has worked in that same setting, or maybe has even been at that same facility, and we can set them up. And then that way they've got that great guide and somebody to talk to and work through issues that might come up.
Well, I think that's what's one thing also, you know, we're highlighting mentorship, and then we're also highlighting the flexibility. I mean, there's pros and cons that come with every benefit to a job. You know, some people can like it and you need to have the right personality, but you know, a lot of people I get asking me are new moms where they are going to have to breastfeed all of a sudden or crying baby all of a sudden. And as a recruiter, you can take care of that and not get in trouble with work at all. But, you know, there are some other jobs where it's like, no, you really have to be, you know, able to answer at any moment and do things at any moment. And so I think that flexibility is really nice for if you have like a baby, or if you're having to be a caregiver for someone, or just, you know, certain lifestyle where you're ADD or something and you want a lot of mixing it up and things like that. And then I think you touched on another thing, which is the salary cap. That's one thing that I think is really neat. And especially for assistants, I feel like assistants feel that salary cap in therapy maybe a little bit more than therapists. And so to be able to make potentially like 100K, and I don't, you know, we can talk maybe in a minute about salary because I don't want to misspeak anything, but as an assistant, that's just never a potential option in therapy.
100%. That is probably one of the biggest reasons that I made this transition in career, is because of the ceiling that I had felt as being a PTA. I love clinician work. I love my patients. That's probably one of the things that I maybe miss a little bit, but I love where I'm at. I'd have to say the biggest thing with the transition coming into the recruiting world is the opportunity to not have that ceiling, the opportunity to grow. And that is just amazing as an assistant, where you want to feel like that you are stuck, because you're not, because you do have opportunities in administration and other than, but this gives you where you're on your own. You're able to make that. You're able to make your own. And it's nice. It's liberating in a way.
That's awesome. Well, let's go a little bit to day in the life, because I think we've sort of enticed people and they're going, okay. So like help explain to everyone what, and I know a day can really change, because when you're dealing with communication and finding people jobs, it can all change like a little bit day to day, but give me like an attempt at explaining a typical day in the life of you guys.
Yeah. So, recruiting, it's kind of like having your own small business within a business. So like the way that I run my desk is different than the way that Mitchell runs his desk. And so like technically, like the travelers, they're employed by Marvel, but they work for me and I'm their point of contact. So I think it helps, like just from the beginning, you set expectations and say like, hey, I'm on call 24/7, but if you need me, like just shoot me an email, send a text. Like if it's an emergency, please call me at 11 o'clock at night. Usually there's not going to be PT or therapy emergencies.
Yeah, recruiting is not like the ER, you know.
But and then I would say like an average Monday, because you're running a business, you have to make sure that every single one of your therapists gets a timesheet in. If they don't have timesheets in, they don't get paid, and we can't bill and we don't get paid. So I would say pretty much all day Monday is spent on tracking down our therapists and getting timesheets, processing them, making sure everything is done correctly, added right, and then turning it in. Then other days of the week, so we usually don't schedule like calls or try to put too much on our plate on Mondays just because of that. Other days we are on the phone talking to therapists, making job lists, sending out our hot jobs that we have for them, and then getting them pay packages and getting people submitted to jobs that they're interested in.
Yeah, I
What
mean,
else?
we're managing, right? We are managing. Honestly, is what we're doing. Building rapport, building relationships, just like you would with your patients in clinical work, except for we're just on a little different spectrum, if you will. And so I see a lot of correlations to practice, but at the same time, we're definitely just managing our desk, and everybody manages it differently. The personality, you don't just have to have a 1A personality to be able to be a recruiter. Several personalities can excel at this position, very much so. It's just honing in on what you're good at and utilizing it.
I love that, Mitch. Can you dive a little bit deeper into that? Because I think that's a really good, next phase. We've talked about why recruiting is awesome and why Marvel is awesome as well. And just shout out to them. And then, a little bit about day in the life. But let's go into that. Like, what kind of personality or what kind of person do you think is really good for this role?
I mean, you definitely have to be outgoing. You cannot be someone that is not willing to have conversations with people. Just like Dyan was saying, I have a couple boys, and so yes, I let them know about my life. I do have a couple boys that I am going to be running after all the time, and if I'm not able to get to them right away, so everybody is different. Everybody is different. So it's knowing who you are, being comfortable, just like as a clinician. There's a lot of relatable aspects to it. You have to be confident, and you have to be comfortable within yourself. And if you're able to utilize that and hone in on it a little bit, I see it being a very manageable transition for sure.
What about you, Dyan? Any thoughts?
I was just thinking about like how he was saying with communication styles. Like Mitchell is huge on phone calls, and he builds these wonderful relationships by talking on the phone with people and really getting to know them. And then you also have to adapt based on your traveler's personality style. So I'm more of a texter, emailer, and there's some travelers who are like, I really want to talk on the phone, and I might not have that time. So I might pass them on to another recruiter who I'm like, oh my gosh, like Kylie loves being on the phone for an hour. So you might match up with her versus I'm more of like on the go, like quick conversations, and everybody's style is just different. And so sometimes like, even if you do interview like a recruiter and they might not line up with what you want, but one of their teammates could. Same with if you're talking to travelers, like as the recruiter, you want to make sure that like personality styles and communication styles match up well too, just so that you have the most success.
Yeah, you're right. I mean, it's not just a sales position where we have to turn it on and just put on a face. It is not necessarily that at all, in my opinion. I mean, I think it's being a matchmaker, finding a good spot for somebody. You traveled. I mean, it's just finding a good spot for them. So finding somebody within a great team to find a good spot for a person.
And I feel like it's like you have to be good at building relationships, like what you talked about, because, a good recruiter, and, this is coming from like me being a travel therapist, what I really looked for in my recruiters and what really stood out to me versus other recruiters was someone who, did not feel like they were a salesperson, but really I felt like mentored me, led me, understood, listened to me and tried to, appease my needs and goals as much as possible. And so I think like listening is huge. And then if you're a good recruiter, you're going to have your therapist or assistant, your traveler for potentially years.
Yeah.
And so you really want to build that relationship because, and this is for those of you thinking about recruiting, like these are the thought processes you want to have, not just to get this job, but to excel. Like these are hints to help you excel, because the bad recruiters, they won't excel in this job because they're not building the relationships. They're not listening to their travelers. When I was mentoring, the biggest complaint I would get from my mentees was that recruiter wasn't listening to like what I wanted, what needs I wanted. And you can't always meet everyone's needs. There has to be realistic expectations. But I agree with everything you guys said. So let's talk about, I know, Mitch, you're newer. You've been doing this about 7 months. So I want to talk about the learning curve, because I think sometimes people can get a little bit afraid, like how much of a learning curve there is. And then Dyan, I want to go to you afterwards and talk about the growth potential and, you know, how it's been for you now almost 2 years into this role.
Yeah,
absolutely. I would say that just like with any other start to any new job, you're walking in, the onboarding process is that you want to learn and soak up and sponge as much as possible. And it's busy. You find yourself getting busy because you are learning, whether it be anything from new softwares or just how the game works, if you will, right? How it works, what's the timeline, what's the prognosis of how things go. I think it's a transition that one is able to make if you're open and you're willing to want to learn. You've got to be open to learning new things. It's not just clinical work where sometimes it's cut and dry and sometimes it's this diagnosis and you're having to deal with this. It's something new every day, like you said, Dyan. And that's the awesome part about it is you are not going to have the same day twice. And that's the fantastic part about it. So if you're open and willing to learn and you trust yourself, then my goodness, it's going to be an easier transition than you think, in my opinion.
Awesome. And if you think about it, most of these skills we already have. Like as rehab professionals, we have to excel in communication, in problem solving, in customer support. And so those are the same skills that I think really you need as a recruiter. It's more like your learning curve is going to be more just like, okay, here's, you know, the technology that we're using at Marvel, which can be completely different at MAS or at club staffing or cross country. You know, you're going to have some little learning curve with, you know, the tools that they use and like the procedures that they do, but like that's so quick to learn. You know, the meat we all already have, and we already have a leg up compared to other recruiters because we have healthcare knowledge. And so if you're especially doing travel recruiting, 10 out of 10 times, I'm going to choose a therapist or an assistant as my recruiter versus someone who's got no healthcare background.
Yeah.
Perfect. And then for everyone listening, if you have any questions for Dyan and Mitch, I like to pop in every once in a while and say, you know, feel free to ask them in the chat, and then we'll ask them a couple minutes later. Okay, Dyan. So we're going to go to you. You've been a recruiter for a little bit less than 2 years now. I remember when you were brand new.
Yeah.
How has that journey been?
It has been awesome. I found out about this job through your Facebook page, and someone in Omaha had posted, she was an OT, and said, we're looking for a therapist who is interested in transitioning into the role of a recruiter. So I reached out and here I am now. So it definitely, I just remember the first week thinking I was learning a new language. There's so many acronyms and just so much lingo that is not what you're accustomed to in healthcare. So I was just taking notes and writing down all these acronyms with VMS and MSPs, stuff like that. So, and then now I look back and I think, gosh, I can't believe that it was just so foreign to me at that point. But it's a different world. We do have like an amazing training program now where like when I started, we were still so small that it was like a day of training, like actually sitting in a room with the owners and then a lot of shadowing after that, versus now we have what we call MarView. And so when our new people come on, they are in this training program for at least 4 weeks, just kind of depending how they progress through the process. And there's a lot of like guidance, and there's like a curriculum now where they like go through things and make sure that like people are learning and
The onboarding, it's a proper
Yeah,
onboarding.
it
It
is.
really is. I mean, I was able to go through it, and they do. I mean, I can only speak for us here at Marvel, but they really do streamline the process well for me, and it was a really great transition. Honest.
Awesome. There you go, people. Don't be scared. Don't be scared. And Marvel seems to be a great company. If you don't know, Marvel is a woman-owned company, which is cool. So hat out to that. And I also really love. I've spoken to the team before, and for those of you at all interested in traveling too, I highly recommend talking to Mitch and Dyan, because it's nice to have a small company that's very focused on your happiness and not just sort of next. And I love what they do with hiring rehab professionals and just excellent quality of trying to find just the best jobs and really have travelers be happy.
Yeah. It's nice. Like, we are such a tight team too, that like when a great job comes out, I'll look over at Mitch and be like, this job is awesome for John. And he's like, you're right. And then, I mean, like we talk about each other's travelers, and we go over who's looking and where they're looking, so that right when we see that great job come out, we can support each other and try to be the first one to get our travelers submitted and find them a great job.
Yeah, you're not on an island by yourself. I think sometimes, I mean, it's something that I even thought right away is, as a recruiter, am I going to be on my own, taking care of my own ship per se? And you're not at all. I think that there are several opportunities out there and several learning aspects that can be had, and they're there if you want them. And being part of the team is definitely a big part of it. Just like you come from your rehab team previous life, if you do want to pursue this, it's similar in that way for sure.
And that is a big reason that Marvel doesn't do the remote jobs. We are all in the office here, and that way we've got that like team building, and we really do feel like a family and have great communication within our team and within other departments. So I do know there's some companies out there that have like remote recruiting opportunities, but we are in office.
And that's where it goes back to the communication. It is all about communication and building that rapport, building that, relationship with your person, whether it be a recruiter or as a traveler.
Well, I knew this question would come up, and so feel free to walk this, because we want to make sure Marvel is happy with everything that we're saying here too. But salary. So within your comfort level, can you try to sort of describe salary and how it's sort of combination of commission and salary and sort of all of that jazz, so that people know roughly what to expect in terms of earnings?
Well, you're going to start with a base salary, no matter where you go, no matter what medical staffing company that you're going to go to, you're going to be able to discuss and negotiate or start with a base salary. That differs per state. I mean, honestly, it just differs all the way around. So you'll start with that, and then your earnings are made off of commissions, and your earnings are made off of how big you want to grow. I mean, there it is. There's no ceiling to how big you want to grow. If you feel comfortable at X amount of people on your desk, and you're able to live the life that you'd like and be able to manage that, then that's great. I mean, sky's the limit. You could put as many people on your desk as much as you feel comfortable and that you're good enough for. And that's what I love about it. You will make your own. So yeah, the salary is a base, and then you're able to build from there.
Okay. Perfect. and I would say, that I know multiple recruiters back when I was a traveler that they were making six figures. Now, was that day one? No. Is that year one? Not necessarily, because really how the commissions are based off of is, you want to find travelers that are going to stay with you, because then every time they travel, you get commission from that. And so the more you can keep rapport with travelers that are traveling for longer periods of time, that's where you can really have this really great salary. Would you say that's fair to sort of say? Yeah. And like you said, the harder you work, like the the harder you work, the more therapists and assistant travelers, the more you are going to earn. But definitely, there's no cap, and you can continue to grow. And so that's nice.
It
And are there
definitely
benefits too?
initially was a pay cut from what I was getting when I was working as a clinician. And so it was a lot of thinking ahead of time, like, am I able to take a pay cut and be okay for the first 6 months while I'm building and trying to like get a full desk of travelers. And so, I mean, the first 6 months are very hard, and you've really got to evaluate if you are at a financial standpoint to be able to do that. Once you hit 6 months, if you're a hard worker and you're growing steadily, then you do start seeing like the fruits of your labor at that point. And then by a year, it kind of got to a point where I was like, okay, now I'm doing good and just need to maintain this at this point. So
Agreed.
Good.
Yeah. Early on, you got to work at it. You have to know what to expect with some of the, hard work that needs to be put in, but, it's definitely, you're definitely able to grow and see those fruits, as you said. That's for sure.
You can see Mitch winking slightly at us.
Yeah, you like that?
I'm just teasing you guys. How about benefits? Because I know everyone wants to know, well, is there health insurance too? Like, despite the commission plus salary, are there benefits as well?
yeah, with Marvel, we have medical, dental, and vision. We have what's called DTO, so it's discretionary time off. If you are working hard and you are hitting goals, then you usually don't have any issue getting time off approved. If you're not a hard worker, and then it might be an issue, and you do have to like get approval through different steps. But as long as you are gung ho and ready to work hard and put in the hours, then it's not an issue getting time off. We also have a 401k that you're eligible for after a year and has a great matching program. So what other benefits?
I mean, benefits are available, honestly, very much so. And just like you would with any other company, if you work hard, you're going to be able to benefit from it. You're going to benefit from your job doing well, and you're going to be able to benefit from some of the perks that do come with the job, like some of the time off as needed and being able to work as needed. And so, yeah, I'd say there's several benefits, just like any other company would be. Absolutely.
Awesome. Perfect. Yay. Okay, let's see here. So we're winding down here. So a couple more minutes, people. If you have any pressing questions for Mitch and Dyan, take this opportunity now and put it below. But if you're watching on the recording, feel free also to put it below as well. And I'll try my best to answer those questions in a timely manner. Now, let's go to any tips for getting this job. Any tips or advice for people who have been inspired and want to try to go the same route?
Like Mitchell said, you have to be outgoing. So that's one thing in your interview. They're going to be looking for someone who is lively and can carry on a conversation and is not afraid to be on the phone.
Confident.
Yeah.
You have to be confident, just like you would as a clinician. Very much so.
And I would say persistence. Like that is a huge thing in this industry. Just because somebody isn't ready to travel now, follow up in 3 months because their circumstances may have changed. So you've got to have that persistence and be very flexible because your day does change quickly. And so you've got to be able to just roll with the punches and
just manage your day right, manage your week right. It is not going to be black and white,
No.
So come in with an open mind. And if you come in with that and some confidence, I think you'll be able to make that transition for sure.
Awesome. Yeah, I agree. Confidence, highlight your healthcare knowledge and that you can really relate to travelers. Highlight that, customer service, communication, technology savviness. If you've done any social media stuff, I don't know how active you guys are on social media, but I definitely know a lot of recruiters who are in like lots of those different groups and get a lot of travelers from that. And so highlighting those things. And I always think coming in with a bit of a plan to show that you're prepared for being a recruiter. And then make sure you've got your resume good, your cover letter good, all that normal normal sort of, preparation that goes into this. And I agree, persistence, I think the hardest thing, and for a lot of things, the hardest thing is to not take things personally. But as a traveler, like you're often talking to several companies, and you may just choose one because maybe they got you a slightly better pay, or maybe they have a job that Marvel doesn't have. And so it's not like you didn't like Dyan or Mitch. It's just, that's the travel opportunity that you needed. And so I think trying to have a little bit of like a thick skin is helpful in the recruiting world.
Agreed 100%.
Awesome. Okay, let's see here. Well, I guess we'll finish up here then with any last tips or words of advice you want to give people out there.
It can be done. It can be done. You can make this transition. You can make this career change for sure. You think about, am I able after 15 years of practice, or, what's going to happen, or what's my opportunities? The opportunities are there. You make it as hard as you want to work. Right. And that's the fun part. That's the great part about this, is that you make your own.
Yeah.
Mitch seems like a very hard worker.
It can be done. It can be done. Well, I'm early on. I'm 7 months in, right? So that's my mindset. It's just constantly going, and you have to be able to just manage it well.
He'll
Honestly,
go home and put his
you have to
kids to
manage it.
bed and make calls.
You have to manage it well, and that's where the buildup is. Like Dyan was saying, the first few months you have to build, but then once you get to that year, the 2 years, the fruits are there. The fruits are there. You can take.
And then you start to get to know people too. So I remember there's a lot for vetted recruiters out there. And so, as people start to get to know Mitch and Dyan as great recruiters, you're going to naturally see in different groups, Mitch and Dyan, recommended. And so it's just like almost like me starting the side hustle, where at first no one knew me. I'm like constantly chugging and chugging and chugging away. And I'm still doing that, working really, really hard. But now more and more people are like, oh, Emma, alternative careers, and so you start to build up that sort of reputation.
Yeah.
What about you, Dyan? Any last tips or words of advice from you?
No, just reach out if you've got any questions, and Mitchell and I are always happy to answer questions, or Emma if you want to field them too. But we're always happy to even serve as a mentor to somebody looking to get into that. So
awesome. Thank you both so much. And if you are listening and you're like, oh, actually I'm a traveler and looking for jobs, definitely check out Marvel. What's Marvel's website again?
marvelmedstaff.com.
There you go. If you do look for a travel job, and then reach out to Mitch and Dyan if you need any help.
Awesome.
Right.
Thank you, Emma.
Thanks, Emma.
Oh, thank you both so much. Thank you, everyone. Leave lots of thanks for Mitch and Dyan for spending a couple minutes away from their family to help out today. I really appreciate it. And everyone, have a good evening, and we will see you in our next video. Bye-bye.